You know that moment when you think, I probably should get that health check or follow up on that scan.
Mm-hmm.
But then you picture it, finding the time, getting to the clinic, navigating the whole system. And it just feels like, oh, too much. Like the info you need is right there, but kind of locked away.
Oh, absolutely. That feeling that healthcare is just slightly out of reach when you actually need it. It's a really common experience, I think. This system we have, well, it has its strengths, obviously, but yeah, those barriers to getting timely care or even just being proactive, they're significant for a lot of folks.
Well, that's exactly what we're digging into today. We're doing a deep dive on a company called PONS. They're looking at ultrasound, that imaging tech, and they're layering on some pretty serious AI.
Artificial intelligence, yeah.
And the goal seems pretty ambitious. Basically trying to reshape how we even think about accessing healthcare.
Yeah, and we've got some interesting pieces to put together for this. We've got information directly from PONS themselves, naturally, but also some broader context from articles looking at healthcare trends generally.
And user surveys too, right?
And some really telling user survey data, yeah. It paints a clear picture of the kind of everyday hurdles people actually face trying to get care.
Right. So our mission here is to really get under the hood and understand how PONS plans to, decentralize healthcare, specifically using ultrasound. We want to see how their tech is supposed to improve diagnostics and ultimately tackle those access problems we started with.
Yeah.
Okay. Let's get into it.
Let's start with the problem itself, the one PONS is trying to solve. The sources we looked at really emphasize how the current, quite centralized healthcare model can, maybe unintentionally, make it harder for people to get regular screenings or those important follow-up scans.
Yeah. Source 157 points that out the structure itself can be a barrier to routine proactive care. And the scale we're talking about isn't small either. Source 150 mentions something like over 30 million people who could potentially use home health care.
Wow, 30 million.
Yeah, so you see how limitations in access could have a really widespread effect.
And it's particularly interesting with ultrasound. Mammograms for screening are pretty common. Relatively speaking, 39 million scans in the U.S., one source said.
Okay.
But ultrasound used for preventative checks, way lower, only about 7 million scans. That gap suggests there's maybe an untapped potential for ultrasound if it were just more accessible.
And that user survey data, it really brings this home, doesn't it? We saw responses from, hundreds of women and men, and their reasons for skipping appointments. There are definite patterns.
What stood out?
The biggest one for both women and men was simply lack of time, 43%.
43%? That's huge. Just can't fit it in.
Exactly. But it wasn't just busy schedules. Some people, about 7% of women, 8% of men, actually mentioned feeling unsafe in a hospital setting.
That's concerning.
And then the simple logistics, the hospital just being too far away, that was cited by 23% of women and 19% of men. Plus, the feeling that the appointment itself just takes too long. About a quarter of people mention that too. It all adds up to major inconvenience.
It really does. And when you bundle those key reasons, not enough time, feeling unsafe, and the distance factor, the sources show that over half of both women, 53%, and men, 59%, have skipped appointments because of one or more of those three things.
Over half. Wow. That's a massive chunk of people potentially missing out on, the vital health information.
And it's not like people don't see the value. The surveys also showed that over 70% for both women and men would actually be willing to pay out of pocket for easier access to ultrasound.
Really? How much?
Most were thinking around $50 or less. But it shows a clear demand, right? People want more convenient options.
Okay, so that sets the stage pretty clearly. The demand is there, the problems are real. So let's talk PONS's solution. Their mission, according to Source 149, is, pretty bold. Bring high-quality ultrasound to the masses using AI.
Right. And their focus, based on a couple of sources, is squarely on scalable ultrasound tech. Stuff that can be used outside the traditional hospital walls in more decentralized settings.
Moving care closer to the patient.
Exactly.
And the core of this seems to be their patented tech, they call it, image enhancement plus digital contrast technology. Okay. That sounds important. What's it actually do?
Well, the claims are pretty striking. Source 171 talks about achieving images with, get this, 10 times better resolution.
10 times.
10 times. Plus, adding digital contrast, and here's a big one, generating 50 times more actual image data from just a single scan.
Hold on. 50 times more data from one scan. That seems like a massive jump in information.
It does, yeah.
And they also mention, interestingly, that this image enhancement part doesn't need separate FDA approval. Why is that significant?
Well, it suggests the main innovation isn't necessarily a whole new type of ultrasound machine, but rather in how they process the images after they're captured. Source 177 explains it improves the clarity dramatically. So much so, it might reveal early signs of disease that you just wouldn't see on a standard scan.
Ah, okay. So it's like software enhancement almost. Taking a standard image and making it much, much richer.
Kind of like that, yeah. Think sophisticated software, sharpening a slightly blurry photo, bringing out hidden details, and crucially, potentially catching things earlier.
And it's not just for ultrasound. Source 175 said it's modality agnostic. What does that mean?
It means the same enhancement principles could potentially be applied to images from other sources too, like mammograms, MRI, CT scans, even X-rays.
Wow, okay. That makes it potentially very versatile.
Extremely. And Source 176 sort of compares it to traditional ultrasound modes, like B mode or contrast-enhanced ultrasound. PONS seems to be offering a way to get that enhanced view without needing to inject contrast agents for ultrasound, which is a big plus for patient comfort and safety.
Right, no injections needed for this enhancement. Now let's circle back to that huge data increase, 50x more data from one scan. Source 178 claims this massively boosts the accuracy and reliability of their AI models. How does more data equal better AI in simple terms?
Think of it like training someone. The more examples, the more detailed examples you give them, the better they get at spotting subtle patterns and making accurate judgments.
Makes sense.
So by generating so much richer data from each scan, PONS is essentially giving its AI a much, much better education, leading to more trustworthy analysis, hopefully fewer false alarms or misdiagnoses.
This all sounds incredibly advanced. So what could this actually mean for patients and the healthcare system? Let's talk about their virtual second opinion platform, the VSO. Sources 153, 168, 180 mention this.
Yeah, this is where that decentralized care idea really comes alive. Source 156 contrasts the PONS patient journey with the usual rigmarole. Instead of, multiple clinic visits, waiting.
Usual headache.
Right. You might have a scan done much closer to home, maybe even at home eventually, and then you get the results, maybe even a specialist's second opinion remotely via telemedicine, perhaps within just a day or two.
That's a world away from the current process, which can be so time-consuming and, frankly, stressful. And the impact of these VSOs, these virtual second opinions, seems pretty significant according to the data. Source 180 found that in 67% of cases, the VSO actually recommended a change to the diagnosis or the treatment plan.
67%. That's substantial. And it doesn't stop there. In 85% of cases, the VSO suggested an alternative to surgery.
Wow.
And it also led to significantly lower rates of recommended hospital stays, down 62%, and fewer follow-up visits needed, down 55%. That points to not just potentially better outcomes, but also way more efficient use of resources.
And efficiency usually means cost savings. Source 180 mentions potential savings between $10,000 and even $100,000 per patient per year.
Per patient per year. That's potentially game-changing on a system level.
Absolutely. And Source 181 mentioned a 90% cut in the time it takes just to get the report and that second opinion. Speed matters when you're waiting for health news.
Definitely. And if you zoom out, sources 182 to 185 list a whole range of benefits this PONS tech could enable. Things like faster image reading by clinicians.
Which must help with radiologist workload.
Exactly. Helping with radiologist shortages, getting access to data on early stage disease, which is often lacking, making patient triage smoother, supporting those hospital at home models.
It sounds like it touches so many different pressure points. Better diagnosis, smoother operations, freeing up specialist time, getting patients home sooner, filling data gaps, boosting ultrasound use, maybe even closing that gap between healthcare access in cities versus more rural or suburban areas.
It certainly seems to aim at all those areas. And, it fits into this wider trend. Source 151 noted there's something like $60 billion being invested in AI within healthcare overall.
$6 billion?
Yeah, with $20 million of that specifically going into radiology AI. And they expect a return on that investment pretty quickly, like 10, 14 months. So there's clearly a huge appetite for these kinds of tech solutions.
Okay, conceptually it's powerful. But is it just concepts, or is PONS actually doing this in the real world? Any traction?
Seems like it. They've got some pretty significant pilot projects running. Sources 187 and 188 mention work with big names like Roche and the Mayo Clinic.
Okay, those are major players. How's it going?
The reported results sound very positive. Over 90% accuracy in their AI analysis, over 70% improvement in the actual image quality reported, and they've apparently already processed and enhanced over 1.5 million images through these pilots.
1.5 million images already? That's not insignificant. And it's not just Roche and Mayo, right? The list of other partners looked quite long.
It is. You see names like MS Cruckers, big pharma like Sanofi and Cheesy, other imaging companies like Canon and Bayer, large hospital systems like RWJ Barnabas Health, Acibadem Hospitals, even AARP is involved.
AARP.
Yeah, that breadth of partners across research, pharma, tech, and healthcare delivery, it does suggest the technology has pretty broad appeal and potential applications.
So what's next for them? Source 187 laid out a bit of a timeline.
Yeah, they're aiming to launch their PONS Gen AI platform sometime in the first half of 2025. Then looking to start generating revenue from licensing it out later that year, Q3 or Q4.
And longer term.
It's the Series A funding round targeted for 2027. So they're moving from pilot phase towards commercialization.
And the team behind it, the leadership and advisors.
Sources 189 to 191 give some background there. It looks like a solid mix of expertise from, respected universities, major medical centers, and big industry names like Siemens, Stanford, Texas Medical Center, HCA Healthcare. It adds credibility for sure.
Right. And they picked up some recognition too, awards and things.
Yeah, being part of that AARP H-Tech Collaborative is one thing. And they've received awards like the WIPO Global AI Award, an EU Innovation Award, signs that the tech community is taking notice.
It really feels like, as Source 192 put it, their core aim is unlocking that missing data gap in healthcare, trying to see what we currently can't, especially in those early crucial stages of disease.
Precisely.
So wrapping this up, the big picture seems to be PONS using this blend of enhanced imaging and AI to try and make high-quality ultrasound way more accessible. Democratize it almost.
Yeah, that seems to be the goal.
Which, for individuals like you listening, could mean much more convenient access, maybe faster answers, potentially even better earlier diagnoses down the line.
And for the healthcare system overall, the potential's there for, serious cost savings, using resources more effectively, and just improving how care is delivered across the board.
It definitely makes you pause and think, doesn't it? How could these kinds of advances in, easily accessible imaging and smart AI really change preventative care in the coming years? And maybe even how you personally approach monitoring your own health and well-being. Mm-hmm. And beyond ultrasound, what other parts of healthcare might be ripe for this kind of decentralized, tech-driven transformation? Definitely food for thought after this deep dive.